Hello, all. Our project is called Leading Through Menopause Narratives from Women in Global Health. This was a joint project between me, Joanna Skinner.
And me, Jessica Backman-Levy. Together, Joanna and I have almost 4 decades of experience in global health, and we're both at an age where this topic hits home on a personal front.
Worldwide, 47 million women enter menopause every year, many at the peak of their professional lives. In this moment, 1 in 5 working women are navigating menopause. Despite its impact, there's a striking lack of research, dialogue, and workplace policy addressing menopause among women leaders. We wanted to use our project to bring visibility to this unspoken leadership challenge by combining research and storytelling to create a set of menopause monologues, narrative pieces drawn from women's lived experiences. Our goal is to shed light on this issue, shift organizational norms, and catalyze dialogue and organizational change.
So, why does this even matter? Well, first of all, there has been very little research on the impact of menopause on women's work, and specifically on their leadership growth. The research that is out there shows that menopause is widely misunderstood, minimized, and ignored in society, including in workplaces. And this is also true in the global health community. Furthermore, addressing menopause is also a business imperative. The impact of menopause at work affects a woman's well being, career, and earning potential. In fact, a recent UNFPA report shared research that global productivity losses linked to menopause now exceed an estimated 150 billion each year. There's a need for intentional support and systemic change. Without it, workplaces, including global health organizations, risk losing experienced, high potential talent at a critical leadership stage.
So, we decided to explore how menopause intersects with women's leadership in global health through three key questions. First, from a personal perspective, we wanted to understand how women experience menopause in the workplace and in what ways those experiences shape their leadership trajectories. Second, we wanted to explore how workplace cultures, policies, and relationships influence the level of support women receive around menopause and how openly women are able to discuss and navigate this stage of life at work. Lastly, we want to understand what policies, practices, and cultural shifts are needed to better support women navigating menopause and strengthen their leadership pathways.
To answer these questions, we started by conducting a rapid literature review to understand what evidence exists and where the knowledge gaps are. We then began data collection, and to date, we've held 2 focus groups and 2 in-depth individual interviews. For this first phase, we spoke with women working in global health in North America, but as we'll share later, we plan to continue this research with more women in other global contexts.
Our interviews show that menopause is not simply a personal health issue, it's a workforce, leadership, and equity issue. The transcripts collectively demonstrate how silence, stigma, and lack of accommodation contribute to leadership attrition, while supportive environments could convert this life stage into a period of leadership renewal rather than withdrawal. There were 5 themes that emerged across our focus groups and interviews, but due to limitations on time, would like to focus on these first 3.
So, across all discussions, participants repeatedly described symptoms like brain fog, memory lapses, fatigue, disrupted sleep, and physical symptoms that directly affected how they showed up at work, particularly in meetings, interviews, and leadership roles. This theme was selected because symptoms were described not merely as discomfort, but as actual threats to perceived competence and authority. For example, one participant said, quote, "It makes me wonder whether or not people trust my capability to do and lead." Comments like these demonstrate that cognitive disruption is not just episodic, but it can be identity threatening, particularly in knowledge intensive, leadership oriented fields like global health.
Across interviews and focus groups, few had ever discussed it at work. The absence of dialogue or policies created isolation and uncertainty about whether they were the only ones struggling, even in reproductive health organizations. This silence intersects with ageism and gender norms, reinforcing fear of disclosure and perceived professional risk. It also came up as people had to transition to finding new jobs because of the funding crisis and USAID shutting down. For example, one participant said, quote, "Often we just suck it up and we do what we need to do. We don't want to be perceived as all over the place or too emotional."
The good news is, and despite the challenges, many participants described unexpected benefits, like reduced people pleasing, clear priorities, great authenticity, and stronger boundaries. This theme is critical to avoid a deficit only framing. menopause can actually function as a leadership inflection point, fostering more intentional, ethical, and sustainable leadership when institutions allow space for it. And that is important. As one participant said, I care more about authenticity and protecting my peace.
Breaking the taboo starts with visibility. Women talking to women at work, women talking openly among male colleagues, and women leaders naming their experience. All these things help others feel seen and starts to normalize the conversation. It also helps generate ideas for how workplaces can support women leaders navigating menopause. Without this discussion, women don't even really know what to ask for from allies or from their workplaces. Small organizational support strategies, such as flexibility in work hours or location, peer support groups, and even just leadership acknowledgement, can have a big impact on retention and morale. Participants also pointed out that there are so many existing women's leadership trainings, but none talk about menopause. Integrating a session on this could be a great first step and something that we will be advocating for within the WomenLift program.
This project reflects the leadership we aim to practice: authentic and surfacing a long neglected issue with honesty and courage, inclusive and broadening the leadership lens to center often overlooked life stages and experiences, strategic and leveraging diverse networks to convene voices and insights across sectors, and impactful in creating a platform where women feel seen and connected while generating learning for managers and leaders. By addressing menopause as both a personal and structural barrier to women's leadership, the project models the values it seeks to advance: equity, intentionality, courage, and lifting others as we lead.
Going forward, there's still a lot we'd like to do. We'd like to conduct more interviews and focus groups with more women in different geographic and cultural contexts to deepen our understanding of this issue. Our longer term plan is to develop a series of 8 to 10 menopause monologues that synthesize the research findings into compelling narratives. We hope to use the monologues to spark empathy and discussion at events and through online platforms and generate dialogue and discussion about this important topic. Thank you.
Thank you so much.